But being a physician, all of our decisions or recommendations we make to our patients are evidence-based, data-driven. So I've seen it work on me. I've heard his personal experience with it, but I haven't seen it work on anybody else. So though I was sold for myself as a product user, and I'm like, okay, we'll keep using products, I never really, knew how it would work on other people. So it's funny, I never thought of it as a business when I started out. If anything, I thought of it as just a fad that was where I was going to lose all this money and never get any of it back in return, which turned out to I got results for myself and like, okay, well, I'll just be a product user, work my way up on the discount scale. And by then we were at a 30% discount. And the business actually kind of found me. I never went looking for the business. I work at a hospital, around a lot of nurses, in healthcare. And I had a nurse come up to me, and she goes, Dr. Parikh, what is that you're walking around with all the time, that shake? Where do you get that shake from? And I started telling her where I got it from, how I'd used it, how much weight is lost. She goes, well, her story. I'm limiting myself to 1,400 calories a day. And I lost a lot of weight, but I can't get any more weight off me. And I still have a fair amount of pounds that I want to lose. You think this can work? Can you help me with that? And I'm like, well, I think I can. This is what I've done. It's worked for me. So what I did, if I remember correctly, I got her on, hadn't met Heather. I think I'd met Heather once or twice, but we never really talked on the phone. She's one of my sponsors, a good friend of Sarah's. And I got her on the phone, put her and Brooke on the phone together. And, I listened to what the questions Heather asked, because I didn't know much about Advocare. I knew just what I was using, what it had done for me. I've only been using it since January, so 3 months. But I didn't know what else it had to offer. And I knew I couldn't really speak about Advocare without using all this stuff. At least I thought I couldn't. So I got her on the phone with somebody who I knew could. So I got her on the phone with Heather, and I listened in, and we got Brooke hooked up and started. And over time, she started getting results. And she's still getting results, and she's still following the program. She's been doing it for 4 months now, and she's loving it. And now she's trying to figure out how she's going to maintain her weight loss. Started with one, worked my way with other people noticing how she did, and coming to me and going, Dr. Parikh, you've helped her. Can you help me? Sure. So again, set them up with Heather on the phone, because there's all like pretty go back to back to back, because I didn't know much. And then we started help 3 people in the month of April, and they've all gotten results, what they wanted, whether it's muscle toning. One of my girls, she's lost weight, started doing CrossFit every day, and she walks with my wife the days that I don't walk or run. So, I was able to see what the results that occurred on me duplicated on other people. So then that gave, for me, credibility to the company, to the program. So then I felt more comfortable about sharing with other people.